Hello, my name is Christopher Santos, and this is my project on illicit drugs. You're most likely curious on what illicit drugs are. They're also known as recreational drugs used to get high. Some examples of illicit drugs are stimulants, such as cocaine, opioids, such as heroin, and psychedelics, such as golden cap mushrooms and LSD. They're often acquired by family members, surgeries, and prescriptions. Illicit drugs are illegal to use, distribute, and also be created. Many people would buy regular day-to-day items to create these substances for their own enjoyment or to profit off of them, due to them being scarce and due to them being profitable. Why is this an important topic, you may be asking yourself? Fentanyl is a very dangerous substance and has tripled its overdoses over the years, especially under these times under COVID-19. It is also important because it is associated with illegal activities. Another reason why it is important is because it would hurt people and their families and others around them. Lastly, it is important because COVID-19 has increased the number of overdoses due to separating families and people. It has also been estimated to reach higher numbers due to COVID-19 this year. Why do we need drugs for teenagers? A popular prescribed drug would be antidepressants, especially for teenagers. According to Racklife, in the 1900s, antidepressants would not affect teenagers, and there is no use in prescribing them because it would not benefit them in the end. It would be best to avoid antidepressants for teenagers. Some antidepressants that are being prescribed to these teenagers are alprazolam, which is also known as Xanax. These are also brands creating the substance. Sertraline is also another substance that is being made by Zoloft. Both of these are used to treat depression. These two substances are the most abused substances that teenagers are using currently. What is being done for illicit drugs? Illicit drugs have been under monitoring programs to track the usage of the drug and to identify problems and misuse of the drug. Also, the Department of Health has limited opioids to a 7-day supply only to reduce the amount of drugs on the streets. The problem. The National Survey of Drug Use and Health has estimated that 12-year-olds and older in 2017 have battled a drug use disorder in their lifetime, at least once. On the bottom right, it shows how much fentanyl is needed to get the same high as heroin. As you can see, it's a very minimal amount compared to the amount of heroin needed.
Recently reported that 39 states have seen a spike in opioid-related overdoses. In some places, like Cook County, Illinois, which includes Chicago, opioid overdose deaths have doubled since last year. In nearby DuPage County, they are up by a third, according to coroner Richard Jorgensen.
It has also been estimated that it would increase even more.
Recently reported that 39 states have seen a spike in opioid-related overdoses. In some places, like Cook County, Illinois, which includes Chicago, opioid overdose deaths have doubled since last year.
Different areas have been affected more than others.
In nearby DuPage County, they are up by a third, according to coroner Richard Jorgensen.
When I looked through these deaths, overwhelmingly, these were people that lived alone, that were having financial difficulties, marital difficulties, previous problems with addiction, or mental health problems. So these are the very needy of our society. And what do they need? They need community.
Addiction is a disease of isolation. And
as you said, many people that are jobless or in poverty or have no job, they usually go to substances.
To have addiction any more so than someone chooses to have diabetes or multiple sclerosis.
Dr. Caleb Alexander is a professor of epidemiology and medicine at Johns Hopkins Bloomberg School of Public Health. He says another effect of the pandemic has been a massive disruption to the illegal drug market.
You know, if you think about the ways that the
There has been a correlation to prescription drugs and to drugs from the market. When people run out of the prescription drugs and they're not prescribed it anymore, or they run out, they would often go to illegal alternatives and usually go to harsher, more dangerous substances. such as fentanyl.
The ways that the pandemic has ground the economy to a halt, that's occurred in the illicit drug markets as well. So, for example, it's decreased the transport of drugs across borders, but it's also disrupted local drug markets and introduced much greater uncertainty regarding what substances are what, and how individuals that do have opioid addiction can find those. And this is one of the reasons that
Once again, it's not only fentanyl that's being used as an alternative substance. People are also abusing cocaine and meth as a substitute.
increased mortality rates that many states have reported due to fentanyl are so concerning.
All right, it's past the time. In this slide, I provided some solutions to illicit drugs. One solution is to make illicit drugs punishable and more harsh. Another solution would to make harsher laws on illicit drugs and how they're being prescribed. All of these solutions would regulate the drugs to avoid misuse and abuse. The conclusion: children should not be prescribed drugs that are antidepressants due to them not being beneficial enough and instead having negative effects on the children. There should be more regulations on drugs and how they're being prescribed. And there should be more monitoring programs. We should have more drug monitoring programs to monitor the intake of drugs being used and consumed. We should also limit the amount of drugs to the public and reduce the supply to have less drugs on the streets. We should limit the availability of drugs to the public to just a few weeks of supply to avoid the amount of misuse, distribution, and overdoses. And here's the works I did. All right, that'll be the end. Thank you for listening and have a good day.